Good afternoon, countrymen and women. Good afternoon, members of the press, and welcome to today's update on coronavirus, the COVID-19 response in Zambia. The government of His Excellency President Edgar Chagwa Lungu continues to prioritize health service provision as a pathway to attaining universal health coverage. Critically important in this agenda is health system strengthening, with one of the fundamentals being public health security. The essence of ensuring that the public is protected from public health hazards is to ensure that, one, we have a healthy and productive citizenry that is able to drive the socio-economic development agenda. Therefore, public health security is pitched as a top priority in our health system strengthening agenda. It is for this reason that in his transformational agenda in the health sector, the President did create the Zambia National Public Health Institute that is spearheading public health security in the nation. So we're joined again today by the team from the National Public Health Institute, led by Professor Victor Munkonka. Let me quickly recognize the presence of a colleague from Cabinet, the Honorable Minister in the Vice President's office, who is coordinating a very important aspect of the COVID-19 response. Honorable Minister, welcome.
Thank you so much.
Like other countries globally, Zambia is battling the COVID-19 outbreak. And as we do this, we have not lost focus on the need for us to combat HIV/AIDS, TB, malaria, non-communicable diseases, to enhance child health, and to fight maternal mortality. I reiterate President Lungu's call that we all remain focused and manage different aspects of our healthcare delivery system, including the public health challenges that we face outside COVID-19. COVID-19 has been with us, and we are now reporting our second month, going to our third month soon. And as guided in the last presidential address, it is important to ensure that we continue adapting and adjusting, resetting to a new way of doing things, guided by the evolution of the pandemic, and ensuring that there is adherence to public health measures. In the last 24 hours, we carried out 903 tests. Now, in carrying out 903 tests, in the last 24 hours, Zambia has carried out 903 tests. Now, I'd like to break down these tests so that I can create a context. There will be the tests that we conducted out of the routine surveillance from our hospitals, out of the routine surveillance from the mass screening in other parts of the country. Then there will also be the bunch of tests that we got from Nakonde. Remember that Nakonde, we've been doing some mass screening and targeted testing, and we've been reporting on the results from Nakonde in batches. So we reported batch 1, where we had 76 cases, batch 2, where we had 174 cases, and these again, 126 cases rather, and these again were not representative of tests done in one day, but a batch of tests that were out of the mass screening and testing. So today we'll be reporting on the third batch of results that came from Nakonde. And we want you to understand why Nakonde results are being recorded in a batch, It is because we have to transport the samples from Nakonde into the reference laboratory here in Lusaka, extract the RNA, and do the testing. After doing the testing, do the validation of the results before we release them. More so that we decided in the last few days to say we needed to do the same quality control programs at the Ndola DRC. It meant that all the tests had to come into Lusaka. So we're reporting on all the tests from Lusaka. So from the 903 tests, 554 tests were conducted from the routine screening, where 12 tested positive. And these are truck drivers that entered Zambia through the Chirundu border. These truck drivers are of various nationality in the SADC region. From the 903 tests, 554 were done from the routine testing. And these 12 tested positive, and this represented the truck drivers coming through Chirundu border, and they are of various nationalities. From the 247 tested during the targeted testing as part of the mass screening in Nakonde, and which included truck drivers, border officials, community members, healthcare workers, 196 tested positive. The other 102 tests that were done involved routine surveillance in our isolation facilities, particularly retesting of those who've been there as part of the criteria to ensure that they are recovering, to monitor their recovery. The cumulative number of cases, therefore, rises to 654, including 7 deaths. Contacts for all these new cases are actively being traced. To date, 124 have recovered from the disease. And remember that we'll continue reporting on discharges as they recover and as they test negative. Currently, 523 cases are active cases in our various isolation facilities, and all are stable except one patient in Masaiti isolation facility who has hypertensive encephalopathy. Appropriate care is being provided to this patient. I also like to report that out of all these cases that we've reported so far, there are a number of districts that are involved. We have Chilanga district with 2 cases, Chilagombwe with 2 cases, Chingola with 3 cases, Chirundu with 22 cases, Kabwe with 16 cases, Kafue with 20 cases, Kapirimposhi 3, Kitwe 1, Luansha 1, Lusaka 150, Masaiti 5, Mpongwe 1, Nakonde 398, Ndola 25, Solwezi 4. This is the situation analysis. So we're not a widening geographic spread of COVID-19 involving 16 countries. As we further analyze the situation, we also pick that in the region, Southern African region, we have Congo DR reporting quite a high number of cases at 1,169 with 50 deaths. Tanzania reporting 509 cases with 21 deaths. And Malawi reporting 63 cases with 3 deaths. Mozambique 104 cases, Zimbabwe 34 cases, 37 cases with 4 deaths. And when we look at South Africa, it has recorded 12,074 cases with 219 deaths as a data reported recently. So this is just to see what is happening in the region from the Africa CDC perspective. As we look at the factors that affect the situation in the country, we notice cross-border road traffic, particularly freight trucks and passenger buses, that continue to pose a huge threat to Zambia's public health. The number of drivers, for instance, that have tested positive from the time that we started doing these tests is 80 to date. The response strategies that we continue to execute involves finding the cases through active surveillance, isolating these cases and managing them. The laboratory capacity is being enhanced as we continue ramping up infection prevention and control. Furthermore, we are enhancing human capital, enhancing human capacity, and also ramping up our health promotion through effective risk communication and engagement of the community. We continue with targeted testing in some communities where we're doing mass screening, and we will focus on places where cases have been reported, but all the provincial directors are in their border areas trying to do routine surveillance to ensure that there is no importation through those borders, and also to ensure that they determine the extent of the challenge in the respective provinces. And reports will be given as they come through. We also want to emphasize that we will continue with quarantine for 14 days of those returning passengers or foreign arrivals. Furthermore, in all our facilities, we'll continue doing routine screening for patients in order for us to ensure surveillance, which is facility-based, does bring up the cases before they contaminate others. Focus on Nakonde operation. The response to the local outbreak in Nakonde and surrounding areas is on course. And the following measures have been done. Isolation facilities have been established in Nakonde, and so far we have 45 patients admitted in Nakonde. We've also identified Chisali General Hospital as an isolation facility, and 39 patients are admitted to Chisali General Hospital. All these are stable. We continue to mobilize staff from Lusaka and other surrounding districts within Muchinga to reinforce the human capital for multidisciplinary operations. In order for us to strengthen quarantine, we continue to work with stakeholders to turn a number of facilities into quarantine areas, and today we will report again with gratitude from the UCZ that Mwenzo Girls Secondary School has been fully turned into a COVID-19 isolation facility, and it's able to accommodate 200 people. At the moment, there are 84 people that are under quarantine in the district in Nakonde. In order to improve efficiency in laboratory testing and in order for us to ramp up testing in the country, we have improved diagnostic capacity, and we've now operationalized Chisali General Hospital as a laboratory testing, as a COVID-19 testing facility. We have activated the Gene Expert platform, and staff have been trained, and we will be doing results, we'll be getting results from Chisali. Cleaning and disinfection of public places has continued, and this has involved a team from various sectors, including local authority, fire brigade, and other stakeholders. Further, we're working with Ministry of Home Affairs and Transport to escort trucks that are ferrying fuel and other essential goods. For now, we are continuing to train multidisciplinary staff in the border, on border operations, security surveillance, and port health staff. And we're continuing to ensure that we ramp up disinfection of public places. Community engagement and risk communication is ongoing and to continue case management. The people of Nakonde are appreciated for the cooperation, and at this point in time, I would just like to remind all of us that in an outbreak of this magnitude, while there is a global health emergency, public health emergency, there are disruptions in various aspects of our lives, and those who are economically vulnerable are worst hit. Again, the government of His Excellency President Lungu has put up social safety nets to support those who are worst hit. And I will invite my colleague from the Office of the Vice President, who will now talk about some measures that they're doing in Nakonde as part of the multi-sectoral whole government response to say a few words on what is happening in Nakonde. Honorable Minister.
Thank you, Honorable Minister. The VS is present, media, and everyone present here. From the Office of the Vice President, we want to assure the people of Nakonde, in Singapore province, that the Office of the President is caring for them. As I'm talking to you right now, Office of the Vice President, we have sent more than 6,012.5 kgs of millimia to ensure that there is food for the vulnerable in Nakonde. For that, the Office of the Vice President is assuring everyone not to panic, so that all what we should be doing is to ensure that we follow the health regulations, which we are being told by health people, where we have to be washing our hands, masking, and keeping a distance. Let's stay home all the time. Thank you so much.
Honorable Minister, thank you very much. Like we've said repeatedly, His Excellency President Edgar Chakulungu has been leading the charge from the front line, and he's been commandeering a multi-sectoral whole government approach to the COVID-19 outbreak. And this is the reason why public health measures will be in place, also mitigation measures to support those who need support are being put in place. So this response is being coordinated in a manner like you see, like you hear the Minister has explained. As we taper to the conclusion of this update, take note that the results released, batched into two broad categories, are talking about the mass screening that we did in Lusaka and other parts of Lusaka and other parts of the country, and also the Nakonde operation. And the Nakonde operation is what has brought out 196 cases out of 247, and this is not, these are results done in 24 hours, but conducted over a number of days out of the mass screening exercise in Nakonde. And take note that out of the mass screening in Lusaka and other parts of the country, out of 554 tests, we have 12 positives. So 208 new cases added to our initial figure that we ended up with yesterday. Therefore, that brings our total number of cases to 654, while our deaths remain at 7. And we have active cases, 523, all stable, except one with hypertensive encephalopathy in Masaiti, and we have 124 recoveries. PS Malupenga, donation session.
Thank you very much, Honorable Ministers, for that brief. It's now time for our colleagues from the media to seek clarifications on what the Minister said. So those with questions? Yes, Staple, we can come to. Ladies first.
Thank you. Patience Mwakei from CTTV. My first question is, the only people that we're hearing being considered as to have taken the frontline role are the health personnel. What is being done for individual media houses, as they have also taken the frontline role ever since the outbreak of coronavirus? The second question since World Health Organization has stated that this virus may not go away anytime soon, what plans does the Ministry of Health have to make sure that there is continuous education on the media to the masses? Then my second question is the Zambia Enrolled Nursing, ZEN, part of the recruitment process being undertaken? If yes, why is that the list of over 500 shortlisted by the ministry only indicates names of the registered nursing? And the last question is, we are arrived to a fact that the mayor office receives some donations which go straight to his office. Are those donations being channeled to the Ministry of Health, and how are they being accounted for? And will the list yet to be published include those donations? Thank you.
Honorable Minister, considering that the number of questions and you may wish to respond to it, please give to other colleagues for questions.
Thank you very much. The response has been very clear from the word go that it is a multi-sectoral response, and a multi-sectoral response requires multidisciplinary teams. And therefore, when we talk of risk communication and community engagement, we're talking about the media, we're talking about health promotion officers, we're talking about the church leadership, religious leadership, we're talking about traditional leadership. So the media are frontliners in risk communication. And we've appreciated the media, and we continue to appreciate the media for the role you play. Even as we inform the nation on the evolution of the pandemic, you, the media, are in the front line. Even as we send teams at the front line to do mass screening and testing, the media is with us. So the media have always been recognized as frontliners, and we appreciate the role of the media. The nurses that we recruit nurses informed by the need and informed by the Treasury Authority. So, we still have a number of positions that are open for Zambia enrolled nurses, and the process of recruitment is still ongoing. So donations to be published in phases through the Ministry of Finance, starting with Ministry of Health and DMMU, as was announced recently at a higher level.
Thank you, Honorable Minister. We have more questions. I saw them on TV this side. Okay. A lady can just walk up to the microphone. So maybe we can just follow one after the other. In the interest of time.
Good afternoon, Honorables. Chimunyango from Diamond TV. Quite a number of questions. And in the case, the first question is in the case of Makonde, people want to know how many days it takes to fully process the test results, taking into consideration that there's also the issue of transportation to Lusaka and verification. Now, an example maybe you will take 3 to 5 days to ensure that the whole process is completed. Is this not a risk to further infection, especially if one is not in quarantine and they are not showing any form of symptoms? Then the other question, the United Nations has warned that the pandemic was causing widespread distress and mental health, particularly in countries where there is lack of investment in mental health care. Governments have been urged to make mental health considerations part of their overall response. How, as a country, are we prepared, or are we faring in the issue of dealing with mental health? Because I understand that, if I'm not been infected, subjected rather to hunger, we found positive and taken to Chisali. How do you plan to address this problem? Then the fourth question, Honorable, the World Health Organization, just my other colleague did ask, but I'm asking it differently. The World Health Organization has, in the last about 10 hours or so, indicated that this pandemic is here with us for a long time. What does this mean in terms of healthcare provision in line with the universal health coverage for Zambia? Thank you.
Your Honorable, again, looking at the number of questions, Honorable Minister, you may proceed to respond to those before we take another session.
Well, thank you very much. Professor Mkonka, could you handle the question on tests?
Thank you very much, Honorable Minister, and for that question. Just to indicate that in terms of the diagnostic capacity, obviously we have established one now in Chinsali, and also we are opening another one in Pika. So meaning we don't need to bring the samples into Lusaka or TDRC. But yesterday they had already installed, today they were doing the testing, training and the testing. So by evening today, they will be running in terms of diagnostic in Chinsali. We are using a gene expert, which is quite faster. It takes about 2-3 hours for the results to be out. So we are aiming basically to have the results out within 24 hours.
Well, thank you so much, Prof, for that reassurance that as we ramp up testing, through enhanced laboratory capacity, we'll be getting the results even quicker and may even be reporting results just based on tests that were conducted or samples collected in the previous 24 hours. As we ramp up testing, the Gene Expert machine is available not only at Chinsali, but in all provinces. Therefore, that means that with more cartridges coming in, all the provinces will have capacity to test for COVID-19. And this is part of the enhanced response, because remember, finding the cases is a fundamental component of the response, because the positives, the number of positives, is a key metric to ensure that you inform strategic policy direction. So it is important that we continue ramping up our testing capacity so that we can isolate those who are positives, so that we stem community spread. When we stem community spread, then we have hope for a COVID-free nation. Universal health coverage remains at the apex of the agenda of this government under President Edgar Chagwa Lungu. Now, a public health threat will respond in a whole government approach with technical leadership being done by the institution that is leading the public health response. The public health response is being led by the Zambia National Public Health Institute, and it's a multi-sectoral platform where we have animal, plant, and human health coalescing. So we will not lose our focus on universal health coverage. And universal health coverage simply refers to all citizens having access to promotive, preventive, curative, rehabilitative, and palliative care services of high quality and without financial risk. That is the statement of intent. And to attain that, we are reforming, re-engineering our health systems to reposition for health for all. And that's the reason one of the fundamentals we're addressing is public health security. And that's why you have the Zambia National Public Health Institute. That does not remove the focus to the legacy goals that have been identified as part of the journey in our National Health Strategic Plan from 2017 to 2021. The legacy goals are on the wall for all to see and to show you that we will not lose focus. We always show the legacy goals right up there. We must reduce maternal mortality from 398,000 per 100,000 to less than 100 per 100,000. And already we have an intermediate figure. It's gone down to 252 per 100,000. We have to ensure that child mortality goes down. And we've already shown you progress through the demographic health survey. We've already reduced from 71 to 61 per 1,000 deaths. We've already shown you that in the government's agenda to ensure that the population is healthy and productive, malaria, which is a big challenge, is being targeted for elimination. We are still doing malaria mitigation activities, and we appeal to the public to continue sleeping under a mosquito net. And as we gravitate towards the peak transmission towards the end of the year, we'll ensure that we do IRS and other vector control measures will also be done. We'll continue recruitment of health workers. We'll continue targeting and pursuing epidemic control of HIV/AIDS. Non-communicable diseases will still be targeted. Mental health remains a fundamental pillar in our health systems, in our health services. Mental health, we have redone the Mental Health Act to align to global trends, to ensure that we restore dignity to patients who have mental health challenges, to ensure we inculcate mental health in primary health care. Mental health is not only at curative level, but also in primary health care. So we are saying, even as we have our patients who stay for long in our facilities, we are addressing issues of psychotherapy. That's why we have mental health nurses, psychologists within our facilities as part of the multidisciplinary teams. Mental health is not going to be put aside. In resetting to the new normal, we will maintain focus on the broad agenda for UHC. In resetting to the new normal, we will not dwarf any of the priorities that we've pitched out in our National Strategic Plan. That's why mental health is high on our agenda, and it's being improved across the continuum, of care. We have food at Chesali Hospital, and our patients are being fed. And I don't know if the question was meant to balance the story or was meant to get a response on a matter where there was a rumor about lack of food. But the answer is that there is food at Chesali, and we don't starve our patients. We don't want our patients to die from hunger instead of COVID-19.
Thank you very much, Honorable. So shall we take some more? I think there's the lady here, Anna, and then the lady asked us for that. You can ask from here. Okay, that's fine.
Good afternoon. I'm Kana Williger from Springview. I have two questions. Dr. Chiluka, what happens to pupils and students in exam classes at Monza School in Nakonde as it has been turned into a quarantine center, yet they are scheduled to open in about 2 weeks' time? Secondly, there's a concern that was raised by a Mbala student about pupils that are able to travel from Mbala to Nakonde and vice versa. On this risk the virus being spread. Thank you.
So those are two questions. If we have one more, so we can make it brief. Come on.
Just clarity on the list from the ministry that is going viral, where there are over 500 shortlisted names. There's more of, I understand that the recruitment process is ongoing, it's still in process, that there's more of nurses, unlike the government science personnel or people. Looking at the coronavirus, we're talking about more work in the lab. Why is it that we've got a lesser number of the government science personnel or people on the list, although it's ongoing, and more nurses? Thank you.
Thank you very much, Honorable Minister. Can I attend to those three?
The response to COVID is clustered on 5 pillars, and we can broadly look at them as surveillance to find the cases, 2, to enhance case finding there's contact tracing. Okay, there is a cluster that is looking at that. There is a cluster that is just looking at risk communication and community engagement. There's a cluster that is looking at laboratory diagnosis. There's a cluster looking at case management. And there's a cluster that looks at just enhancing human capital. Now, when you are looking at the workers that drive those clusters, they are multidisciplinary in qualification, and you will find workers who are doing case management to be maybe nurses, doctors, clinical officers, including, lab techs, because case management involves making a diagnosis, and as you manage the cases, you inform decisions that you make based on continuous investigations, either baseline or repeat investigations. So all the workers are equally important. And what informs the numbers is ability to recruit in terms of treasury authority, and two, what we have looked at in terms of the database. So if you just look at a variable of, say, 100 biomeds out of 1,000, and then you see maybe 2,000 nurses, you may be talking of 2,000 nurses maybe out of 10,000. So it's very important that as we compare, we look at all the variables holistically. But the point we're trying to put across is for us to manage COVID-19 across all the clusters, we regard all the experts in the various disciplines as equally important. And we do not want to put a wedge amongst any professionals. And we do not discriminate as we recruit. Secondly, did you ask another question? The other two questions from our colleague there. Well, we have already commenced our engagement with the Ministry of Education in line with the presidential guidance on the issue of schools. And our engagement is ongoing, and what we're doing is putting in place all the measures as guided by His Excellency the President. And remember that the President directed the ministries to work together to come up with guidelines on the subject. So working with the Ministry of Education on the subject, and if there be any information related to that, we will release the information. But the Ministry of Health and Education are working together to follow the presidential directive on the subject.
Thank you very much. So far, from my count, the minister has attended for about 11 or 12 questions. I want to believe we'll be taking the last step. So, you said you could ask from there?
Yes, I'm camera shy.
Oh, you're camera shy. What's your right cameraman?
My name is Mwansa from Smart Eagles. I monitored closely attempts by some political players to politicize the term or phrase which was coined by the president, the new normal. Now that the World Health Organization has clearly indicated that COVID-19 is here to stay, with that meaning all businesses should operate, governments must continue to function normally. Does this vindicate the president's statement? Does this vindicate your statement on the internationally acclaimed standards in managing COVID-19? Because it's in tandem with what the World Health Organization has indicated today.
Thank you very much. Did I see your hand? Would you mind coming over to the microphone? You're also camera shy?
Okay, for me, I just want to get an update on Pakio. I think at some point it was a hot spot, so I just wanted to know the current status of it.
Okay, so two more. Okay, please come over.
My name is Darius from down in Sweden. However, what we have seen in the board of is it refused to impose a temporary lockdown at Chilungu border post despite these cases that are coming up. We'd like to find out if government cannot impose a temporary lockdown, when are we seeing the ministry conducting mass screening? Because cases have kept on coming in that particular locality. Another question also, from the questions that you have, rather the cases that you have given us coming from Nakonde, we have seen border officers being amongst the active cases. Could you be able to explain to us why the border officers are contracting the virus? Could it be that they don't have enough or proper PPEs? Thank you.
Those are 5 questions, Honourable Minister. You may proceed to answer them. Then I will invite Minister from Zanis, since she appears to only have one, and she can come to ask the last question.
Thank you very much. I'll begin answering the questions with what you said, with what you posed, the question you posed, Mwansa from Mathematicals. The Republican President, His Excellency Dr. Kachagolunga, has been consistent that there is need for us to ensure that in abating a public health crisis, we do not expose our people to other lethal situations such as hunger, poverty, and also that there is need for us to take a cautious approach to returning to normalcy, informed by the Public Health Act and also the evolution of the epidemic. And this has been his consistent message. He's further said he's carefully watching the epidemic through an analytical eye, and that the plan that he has put in place is a scalable one. It's adaptable, it's adjustable, and as we reset to a new normal, the plan shall be informed by the Public Health Act and what we see as the evolution of the epidemic. The President has been very consistent in all his addresses. And what the WHO said resonates precisely with his position, that we need to reset to a new way of doing things to ensure that we balance up the need for us to avoid a health catastrophe while we are ensuring that people do not get vulnerable to other ills such as poverty and hunger. So that delicate balance is the aspiration that he has pitched in all that he has said. And this is the reason why, through a watchful and analytical eye, the pandemic will inform, the data from the pandemic will inform decisions in the adjustable and adaptable, scalable plan that the President is leading. The next question was from Chimunya, and those sets of questions, Chimunya is talking about data. I have repeatedly said that in epidemiology, we place premium on data. In fact, in health, we place premium on data because it informs, one, the state in which you are in. It informs strategic policy direction. So information should not be tampered with. And in Zambia, we are transparent. That's the value of this government under President Lungu. And in the epidemic control, we will never hide figures. We have been consistent. And we have said repeatedly that we will engage the public and inform the public on all the data that comes up. We just appeal to the public to understand that when there are no cases reported, yes, there are no cases reported from the investigations. If there is a spike, yes, there is a spike. And oftentimes we see comments like, there's a spike, why is there a spike? There are no cases, no, why are there no cases? Like, you can't have it right. The point is that the government of His Excellency President Lungu values transparency as one of the values in its approach to epidemic control. So we are not tampering with the numbers, and we report what we are reporting. Further, as we ramp up our testing capacity, it is expected in this surge period that numbers will go up, and we will know when we've peaked, and when we've plateaued, when we'll be going down. And all this data is important as we look at the adjustable and scalable plan that the President is executing. You asked 20 questions. What were your other questions? Well, what you're seeing in Kafue should give us comfort that the response is effective. What you're seeing in Lusaka should give you comfort that the response strategy is effective. Look, Kafue, we noticed some pop-ups. And in Kafue, what did we do? We quickly did some restriction, did some mass screening and testing, and targeted testing, and did an aggressive and robust contact tracing, isolating all the positives. What eventually happens in a situation of that nature is that you will not see new cases when all the contacts are traced and when you're not allowing community spread. This is the reason why you should support the presidential directive to restrict activities in Nakonde, so that Nakonde, we could find all the positives, isolate them, stop community spread, so that we are able to treat those who are positive and not get new cases, and ensure that as we ease the restrictions there, there is safety assured for border control officers, multi-sectoral in nature, and that they are clad in proper PPEs, and that they are trained or retrained as they redeploy to their workstations. So key in the Nakonde operation is ensuring that there is disinfection, there is removal of persons who are positive, isolating them and treating them, that we stop community spread, that as we re-establish normalcy, there is no risk to the people coming in, the people going out, or to the people attending to them. The border staff will get COVID-19 the same way any of us would get COVID-19. Inhalation of droplets, that inhalation through airborne. So you could have these particles also that are on common public places with micro droplets containing COVID-19. You touch with your hands, and as you feed it with your mouth and your nose, you introduce in the respiratory system. So the mode of transmission remains airborne, and you can introduce through airborne by what you touch and fidgeting with the nose and mouth. And therefore, the mode of transmission remains as it is. And as we do our mass operation in Nakonde in a multi-sectoral manner, we'll be able to see results improving. So Kafue, as we report on the mass testing, mass screening and testing, some of the samples are coming from Kafue. Some of the samples are coming from the areas where we've robustly contacted those who are positive.
Would you expect you to commence mass screening in Chilungu, at least because you have refused to impose a temporary lockdown?
Who said we refused?
Well, you don't want to impose that even after recording cases that cannot be compared to the cases that you have recorded at UAE.
Well, first of all, I want to place on record my admiration of the team that is working under the Zambia National Public Health Institute, DMMU, in that area. The provincial team, working with their colleagues in the incident management system, have done a very good job. Because what is happening there is that, one, while they've allowed trade and commerce to continue through movement of essential goods, they have ensured that they've minimized importation of new cases. And they have ensured that should there be any new case, they're able to pick them out and they don't allow them to spread the cases further. That's how an alert surveillance system works. So, like I said, the plan is adjustable and is informed by data. And what we see in Chirundu, when you're reporting positive cases in Chirundu, it is reflecting the alertness of your surveillance system. And that surveillance system is allowing movement of goods, allowing the wheels of the economy to run, while minimizing importation of COVID-19. How are we minimizing it? When the cases are coming in, they're picked out of the quarantine facilities, and community spread is stopped. And remember, we are on record that truck drivers are a huge risk. But truck drivers are essential workers who are carrying the fuel we need. Truck drivers are essential workers who are bringing the food we need. Truck drivers are the essential workers who are bringing in the sulfuric acid that we need. So, shall we say we ban truck drivers? What happens to the essential goods and services? What happens to the petroleum? So we're saying, as we deal with this category of essential workers, we'll ensure that we allow movement while minimizing the risk of transmission and while protecting these essential workers from succumbing to COVID-19. So the whole response involves identifying factors that fuel the epidemic, and yes, truck drivers are a huge factor. We call them essential workers, and what is key is that we have spotlight on them and we're able to do adequate surveillance to know that they are infected or not infected, and as we pick up those who are infected, we're able to quarantine them and manage them. Already, we have discharged quite a few of these truck drivers and they have traveled back to their countries or integrated into our society. So, the response in Chirundu is orderly and is anchored on surveillance, active case management, active case finding and case management. And we are seeing a lot of activities focusing on disinfection, and human capital has been enhanced in those areas, and we see the multi-sectoral response working extremely well in Chirundu. So anything else in that regard will be informed by what we get as data. Just remember, team, that the response plan is not cast in ironmongery. The response plan is based on key pillars, and the decisions you make are informed by the evolution of the pandemic and the public health measures that inform all the decisions, that are made. And I think the position of the country has been categorical. In his addresses to the nation, the President has made it very clear that we will continue to allow economic activity and at the same time minimize the risk of our people getting COVID-19. If that requires scaling up interventions, yes, they will be scaled up. If that requires downscaling interventions, that will be done. And this is why I am saying where he is monitoring with a watchful and analytical eye the evolution of the pandemic that will inform upgrading, downgrading, maintaining, the interventions in the response plan.
Thank you very much, Minister. Allow me to call upon Zanis to ask the last question for the day.
Some of those questions.
Good afternoon, Minister. Cheryl from Zanis. My question is, I want to find out at what point do the health workers have access to the PPEs? This is in the right of health workers getting the virus. We also, in view of the heightened screening and testing, at what point do the health workers get those specialized PPEs that we see people that were in labs when they're doing the testings? And the other one is, I don't know if you have the data on how many Zambians have so far contracted the COVID-19 locally, those in diaspora. Thank you.
question on when the health workers put on PPEs is before they start attending to any clients, they will put on the PPEs. They will put on the PPEs. And we are working hard to ensure consistent supply of PPEs at the front line for all health workers. So we're stockpiling PPEs and distributing to all parts of the country. Secondly, the Ministry of Foreign Affairs does compile data on Zambians living abroad who get COVID-19 and succumb. And this data, we collaborate to ensure that we understand the full extent to which Zambia has been affected, informed also by our brothers and sisters who are outside of the country.
That's all for the day. I want to also just wrap up and give us the cover point.
Countrymen and women, COVID-19 is first a public health emergency, but COVID-19 has terrible effects on many aspects of our livelihoods, be it our education, be it our business, the economy, and therefore it is important that as we respond to COVID-19, we take a whole government approach. We ensure that we cover the vulnerable. This is the reason why social safety nets are an important part of the response plan. You will see the DMMU under the Office of the Vice President continuing with social mitigation measures. Public health interventions will run side by side. Collaboration with other ministries is critical. As we do the Nakonde operation, we have ministries of Home Affairs working with us to ensure that the border control is enhanced by having staff that are trained and clad in proper PPEs. We are working with our colleagues in the media fraternity to ensure enhanced risk communication. We're working with the community, and that's why it's critical for the community to take part in the response. We want to thank the corporate world, individuals in the communities that have continued to work with government in this regard, and that is indeed community engagement. So we will continue carrying out the interventions that we're carrying out under the response plan, and it's important to remember, colleagues from the media, the members of the public, that the response plan that has been put in place by the government of His Excellency President Edgar Chagolungu anchors on 6 major pillars: surveillance, risk communication and community engagement, case finding, case management, laboratory diagnosis, and enhancing human capital. All we are doing is in line with this. And as we do all this, as we communicate to you on how to support the response, please, when we talk of risk communication, we're saying mask up, wash your hands, keep away from public gatherings, ensure non-essential travel is postponed, and make sure that physical distancing rules are in place. The government of His Excellency President Edgar Chagolungu will continue cautiously addressing all sectors of our economy and ensuring that the reopening is in line with exactly what the President has said: public health measures and also monitoring of the evolution. That has been the consistent message. Aspiration to allow the economy running and avoiding a public health crisis. Resetting to a new normal that ensures that we are able to do what we are supposed to do without putting ourselves at risk of a worsening crisis. That has been the consistent message. So I urge you on as you continue supporting this government in the COVID-19 response. 654 cases cumulatively with 7 deaths total, and 124 recoveries, 523 cases active under management, 1 case critically ill or not so stable with hypertensive encephalopathy, the rest stable. And we continue to mount the response in various parts of the country. Nakonde operation ongoing. All the provincial directors working under the provincial ministers are keeping vigil in all the border areas, carrying out surveillance activities and ensuring that cases are picked in those communities and ensuring that as we import goods, we don't import COVID-19. Should we have those cases, we're quarantining them and ensuring they don't enhance local transmission of cases. The media, we thank you for your great support, and God bless them.